When should I sign up for Medicare?
Well, Carolyn, that's a good question. You should definitely try to sign up for Medicare within the first 3 months prior to your birthday month. The actual full sign-up period is 7 months. It's the 3 months prior to your birthday month, and you have 3 months after your birthday month. The reason you want to sign up in the first 3 months is so that you don't create any gaps in coverage. If you sign up after your birthday, you might very well not have coverage during the month of your birthday or until the insurance, the Medicare coverage actually kicks in.
So what should I do during this time?
A lot of homework, to be honest with you.
Okay.
First thing I tell everybody is you should make 2 phone calls. And you should be working on this 6 to 9 months prior to your 65th birthday, is to make 2 phone calls. You should call, if you have current insurance, which many of us do, you call your current insurance provider, or if you're already on retiree insurance from a past employer, you need to call them and you need to ask them to explain to you how your insurance coverage works with Medicare. And then you also need to call the Social Security Administration and ask them the same questions. And then I'd advise you to make sure you document it. Document who you talked to, when you talked to them, and what advice they gave you, because if mistakes are made in sign-up, you could be saddled with long-term penalties that'll increase your cost of coverage when you actually do get it.
That's really helpful. How much does Medicare cost?
Well, you know, a lot of people think Medicare is free. You know, and they get that idea because Medicare Part A is free of premiums once you enroll and are eligible, but only if you've already worked 10 years and paid payroll taxes that paid for Medicare Part A. So it's technically not free, but you don't pay an additional premium. And then Medicare Part B, there's a monthly premium that currently in 2017 is around $134 per person, okay? And then on top of that, there's Part D. And Part D is your drug coverage plan, and that can be somewhere around $40.
And how do I pay for Medicare?
Well, there's several ways. Like when you get to age 65, if you're already on Social Security, say you start your Social Security early for one reason or another, you automatically be enrolled, and your premiums will be automatically deducted from your Social Security check. However, if you're not, if you're still working, or if you haven't enrolled in Social Security, Social Security Administration will actually bill you, and you'll be responsible to make sure that your payments get paid into the program.
So if you're not receiving Social Security when you turn 65,
well, that's basically what happens. You have to enroll, and you will be responsible for paying the premiums yourself.
Very good. What is a Medicare supplemental insurance?
Well, Medicare, as good of a program as it is, still leaves an awful lot of costs out. For example, the Part A hospitalization part of Medicare only covers 80% of your hospitalizations, and that's only after a sizable $1,300 deductible. Part B, for example, has a much smaller deductible, $130, $140, something like that. But there's still only there's a 20% co-insurance cost to the services that you obtain under Part B. And so supplemental insurance is the insurance that you need to buy to cover those gaps for those deductibles, those premiums. Also, the thing that's really surprising to people is that there's no out-of-pocket maximum to either of these.
So what are the 2 basic types of Medicare supplemental insurance? That sounds pretty important.
It is, and it's part of the thing. It's part of the information that people have to sort out before they get to age 65 for sign up. But there's 2 basic ways to enroll and purchase supplemental insurance. There's the traditional Medicare, which involves the Part A, Part B, and then a Part D prescription plan, and then a supplement to cover those co-insurance costs, the deductibles, the things that your Medicare insurance is not going to cover. And that's called the traditional Medicare, and those supplemental plans are called Medigap plans. Then the other way to go is what's called Medicare Advantage, or what people refer to as Part C. And that's where you deal with an external private insurers and purchase an insurance plan coverage that integrates everything together through one program. Each of these could cost somewhere around up to $200 a month, in addition to in the Medigap process, a $40 approximate cost for a prescription drug plan, where in Medicare Advantage, the drug plan is usually an integral part of the Medicare Advantage plan.
Well, I retired prior to age 65 and went on to my former employer's retiree plan. Do I have to enroll in Medicare at 65?
Yes, you should absolutely assume the answer is yes. But again, that's what you'll learn more specifically if you do the homework I referred to earlier. You need to contact your insurance provider or health plan administrator. You need to get that information up front to understand how that retirees insurance program coordinates with Medicare.
You've been referring a lot to the homework, if you will. So what is the homework you referred to earlier?
Well, it's the kinds of things I was talking about. You need to, first of all, make sure you know the enrollment requirements, as I talked about in the earlier phone calls. But most importantly, then, what your current insurance does or doesn't do, how it coordinates with Medicare, how it doesn't, and then understand how much is it going to cost you as a retiree once you go on Medicare. Will it be supplemental to Medicare? In almost all cases, that is the situation. And then once you understand that, then you want to go out and you want to research the marketplace to decide what is my cost of the premiums, even though I'm on a retiree insurance program. Many of us, like myself, we have a premium to pay to supplement my employer's cost, and you need to compare what that provides you versus what you might be able to get by buying a Medigap plan or maybe a marketplace Medicare Advantage plan. In many cases, you might do actually better. You might get more coverage for your dollar than perhaps continuing on your retiree's plan. But that's a perhaps, and every person's situation is unique, and that's why you got to do your homework, and you got to do it in time before you reach enrollment at age 65.
Absolutely. What does Medicare cover?
Well, Medicare, as we said, Part A is hospitalization. That'll cover hospitalization, hospice care, some shorter-term nursing home, not nursing home care, skilled nursing programs. Part B covers doctor's visits. Many of the services go along with that, as well as some preventative services, like colonoscopies, for example, or mammograms, for example. Part D, obviously, are drugs. Okay, there's a drug plan, and an important part of that is part of the homework is to make sure the Medicare Part D drug plan that you pick actually covers the drugs that you might already know you need, because all Medicare Part D plans have their own unique list of covered drugs.
What doesn't it cover?
Well, there's a booklet that I'd like to mention to steer you to, and it's called Medicare and You. It's available free to everyone, and I'd have to say it's one of the better government publications I have seen. It's available from the Health and Human Services website, and it'll list a more comprehensive list than I just happened to mention in terms of what Medicare does cover. There's also a section that lists the things that Medicare doesn't cover, and that's one of the best resources I have found to steer people to answer that question for themselves. But there are a number of things like elective medical treatments, like chiropractic services, for example, are not covered. Dental, vision, eyes, glasses and things like those types of things are not covered by Medicare.
You have an incredible wealth of knowledge, and it's just been a pleasure talking with you. What should people do if they want more information?
Well, they should, they should talk to their advisor, okay? If you're one of our clients, okay, I'm here to help. I help all my fellow advisors' clients where needed when they have questions. But the thing about Medicare is people can only do so much for you or help you know what you need to do, but a lot of it requires you to do it by contacting your health plan administrator, because you're the only person that they're going to share your personal information with.
Could people also check your website?
Well, absolutely. They could look at our website, and I'd still also say, no matter what, even if you make contact with us and you're getting help and information from us, I'm still going to recommend you get that booklet, Medicare and You, because it is really quite a good publication. It's easy to read, easy to understand, and very comprehensive.
Thank you so much.
You're welcome.